So as we wait for more participants to join in the next few moments, again, a cordial welcome and some, let's say, brief housekeeping rules. So when you enter, your microphones should be turned off already automatically. If that's not the case, we would like to ask you to turn it off proactively. And I assume that questions can be posed by the chat function of the Zoom web conference program. And my colleague, Ms. Asma Natali from Afrika Verein, will try to get notice of all your questions and remarks so that we have later, after the round of panelists, active and lively discussion. So please feel really cordially invited to interact with our excellent lineup of panelists. So we'll wait a few minutes more so that we will be able to get hold of all participants entering the room. I see Ambassador Shao has also joined, so cordially welcome, Excellency. It's wonderful to have you here, that you joined this panel. And already before we officially begin, I would like to thank, of course, all our panelists. I will do this also later in the official welcome, but for now, we just wait a few minutes more, let's say very few minutes. We will have enough time, enough buffer time, so we will not run out of time. So we'll start in Ms. Nitardi, I'm looking towards you maybe in two minutes. Yeah. Yeah, I guess we will start. So cordial welcome. My name is Roland Göde. I'm a member of the board of Afrika Verein and chairman of the board of the GHA, German Health Alliance. And it's a privilege and pleasure for me to welcome you all, to welcome all our panelists, an excellent lineup of panelists. I would like to specifically welcome His Excellency Ambassador Schauer, Ambassador of the Federal Republic of Germany in Kampala. And I would like, of course, to welcome all our participants. And I would like to thank every one of you for your flexibility, as this specific session has been shifted twice in terms of date and time, with the last change just recently being announced by the organizers yesterday. So we are really grateful for your flexibility, for you making this panel discussion possible. And I would like to thank especially also the World Health Summit, both teams, the regional team in Kampala, as well as the World Health Summit team in Berlin, for kindly allowing us to have this panel discussion in the World Health Summit regional meeting in Kampala. And we would have loved to be now in Kampala, as it was planned already for last year. So that was our firm plan, to have a half-day symposium. So you may see in the title of today's panel discussion, it was really planned as a more extensive symposium rather than a 1.5 hour discussion. So we really hope that everyone being in Kampala now physically is enjoying the excellent setup and the excellent ambience of the venue in Kampala. I heard already a very positive information about the local, let's say, the local setup of the World Health Summit regional meeting. So today we will go through this joint panel discussion, which has been co-organized by the Africa Fine, which is the German African Business Association, and the GHA, the German Health Alliance, under support of the World Health Summit. And with this, we would like to create a platform for networking, for exchanging ideas, experiences, ways forward between leading African and German healthcare stakeholders and African healthcare stakeholders with an international view, and also stimulated by the experience from international organizations. And of course, our aim is to foster deeper cooperation, more sustainable cooperation on the different fields and areas in health on the African continent. And before adding some notes, I would like to cordially welcome by name and function our today's special guests and panelists. So first of all, cordial welcome Ambassador Schauer, Ambassador of the Federal Republic of Germany to Uganda. His Excellency has been previously Deputy Head of Mission to Ethiopia. And when saying Ethiopia, this of course also means that one of the focus areas has been the African Union. And Ambassador Schauer has served at the German permanent representation to the United Nations in Geneva. He has gained experience in European Union affairs, both in Brussels and Berlin. If I'm correctly informed, your first post has been in Seoul in the Republic of Korea. And Ambassador Schauer is in Kampala since July 25th of last year. So cordially welcome again. It's a privilege to have you here today. I would also like to welcome our round of panelists. So every one of our panelist group will be presented more in detail by my colleague Asmauni Tardi, who will be also the moderator of today's event, and taking your questions and leading through the discussions. And so I would like to welcome Dr. Modrek Chibi, Regional Advisor, Innovation and Digital Health at the World Health Organization, the Regional Office for Africa. I would like to welcome Douglas Graf von Sauer-Mayaich, who is the President of Malteser International in Europe. Then cordial welcome to Ms. Agnes Magiru, Head of Enterprise Services, Middle East, Southern and Eastern Africa of Siemens Healthineers. Dr. Senait Beyene, Senior Advisor to the Health Minister of Ethiopia and President of the Ethiopian Medical Women Association. Cordial welcome goes as well to Dr. Berit Hama, Director of Governmental Affairs and International Cooperation of Otto Bock, and Koen Paradis, Managing Director, Middle East and Africa of Drägerwerk. And again, this round of panelists will be moderated by my colleague Asmauni Tardi. And I don't want to talk too much as we have so many excellent panelists, and as we have lost a little bit of time in the beginning, just some very few notes. We will look today on digital solutions, on innovative healthcare solutions, which are specifically suited for being used on our neighbor continent Africa. We would like to look on programs, on successful programs which have been initiated by governments and international organizations, also initiated by companies, by private sectors and NGOs. And we would like to hear from our panelists already involved how these programs look like and how they can be improved, and especially how they can also, let's say, build in a systemic effect when being, let's say, thought together, when being combined whenever possible. We will look to the role of medical technology under the umbrella of the focus of universal health coverage. We will look to the question of how German actors, companies and NGOs may contribute to reaching universal health coverage in Africa as one of the fundamental goals of Sustainable Development Goals of the 2030 Agenda of United Nations. And of course, we would like to discuss on challenges which we face when implementing such solutions and developing strategies. And we would like to hear from our panelists and from the discussion with all participants about recommendations, how to overcome challenges and how to detect opportunities and to lever the potentials. And of course, it's a little bit difficult, I would say, to look on this more general long-term aspect under the current scenario of the corona pandemic, which is really obviously developing very badly in a number of African continents. And the news we get from different countries, just to mention Namibia, Uganda, and others, are disturbing and really sad. And I know for many colleagues losing friends in the countries. So it will be quite a challenge in this panel, let's say, to look more on the broader long-term aspects, which we will try, and for a moment to not focus everything on COVID. But of course, we must take the lessons learned of the COVID-19 pandemic. It's absolutely crucial that we do not lose these lessons we have to learn. To me, it reminds me to the Ebola situation just 7 years ago. We thought already that has been a wake-up call when it comes to epidemics and pandemics. We thought there were enough lessons learned, but it seems that a couple of lessons were noticed by us, but not really learned and not digested completely. So under this light, we would like to really focus on the solutions which help to strengthen health systems and to achieve universal health coverage on the African continent. And with this said, I just on purpose want to keep my welcome note very brief. I would like again to thank everyone involved. Again, thank you so much for your flexibility to make this possible with the shifted timing we have now to start this event today. And now I would like to hand over to His Excellency Ambassador Matthias Friedrich Schauer. Again, thank you for being here, and your input, your welcome will be of specific importance, and the floor is yours.
Thank you very much, Mr. Goethe, for your kind words of introduction. Ladies and gentlemen, it is my pleasure to welcome you also to the German-African Business Healthcare Symposium within the framework of the World Health Summit regional meeting in Kampala. The World Health Summit is one of the world's leading strategic fora for global health, and it brings together leaders from politics, science and medicine, the private sector, and civil society to set the agenda for a healthier future. The World Health Summit was founded in 2009 on the occasion of the 300th anniversary of Berlin's Charité Hospital, and is traditionally held under the patronage of the German Chancellor, the President of France, the President of the European Commission, and the Director General of the World Health Organization. The academic foundation of the World Health Summit is the M8 Alliance of academic health centers, universities, and national academies of medicine and sciences, a unique network from all over the world. In addition to the World Health Summit in October in Berlin, the M8 Alliance organizes annual regional meetings and expert meetings around the world, just like this one here in Kampala. And I'm very happy to say that this is the first regional World Health Summit meeting on the African continent. The vision behind the World Health Summit is to improve health worldwide through collaboration and open dialogue, steering tomorrow's agenda towards the improvement of research, education, healthcare, and policy outcomes. The World Health Summit promotes a science-driven and broad approach to global health development in line with the Sustainable Development Goals. Interdisciplinary and cross-sector exchange is at its core. Health is much more than just medicine. Health is also a human right. For both individuals and societies, nothing is more important. Only a holistic approach to health that includes biology, lifestyle, and environment can deliver positive results. If we want to succeed, sustainability, science, politics, civil society, and the private sector must work together to improve health and living conditions for everyone, everywhere. This is the aim of the World Health Summit. Today, in the light of the COVID-19 pandemic, the focus is on digital and innovative health solutions towards universal health coverage in Africa. This topic is in particular relevant, especially now. The panel will be exploring possibilities to improve universal health coverage in Africa and how German companies and organizations can be a part of this effort. 14 months after the virus spread globally, much experience has been gathered and multiple challenges have been successfully met. Vaccines can now prevent COVID-19 infections, tests can rapidly and accurately detect them, and new treatments have saved lives. All this is due to knowledge we've been able to acquire just over the past year. However, Africa has not yet benefited nearly enough. The rapid development, scale-up, and equitable distribution of COVID-19 vaccines, therapeutics, and diagnostics is urgently needed in Africa. This can only happen if we join forces. Our goal must therefore be to strengthen the health system in Africa as a whole. WHO plays a pivotal role here, but without strong support from the private sector, we will not succeed. Public-private partnerships will be key. Since developing point-of-care technology is costly, investors will also expect a reasonable return on their investment. The German government has also done its part so far and contributed 2.2 billion euros to the COVAX facility, and will have shared almost at least 30 million vaccine doses with developing countries by the end of the year. Let me conclude by thanking Afrika Verein and GHA for having organized this symposium. We see a strong role of the German private sector in providing the solutions necessary for a universal health coverage in Africa. The next edition of the World Health Summit will take place in Berlin, 25th to 27th of October of this year. In its margins, on the 27th of October, the 8th edition of the German African Healthcare Forum will take place, and we will be very happy to see many of you there again as partners and active participants. Let me now hand over to Ms. Nitadi, the chair of the panel. I wish you all a very fruitful discussion. Thank you very much.
Yeah, thank you very much, Excellency. Yeah, as we are all set to discuss this interesting topic, I would like to just go quickly through the panel and introduce the panelists, starting with WHO, because that is the most important organization at this point of the world, I would say. We have Dr. Chibi. He is the Regional Advisor, Innovation and Digital Health, World Health Organization, Officer for Africa, based in Kinshasa. He's been working there previously also as a role as in the transformation agenda, whose objective is to accelerate the implementation of WHO reforms within the African region. And he's also serving, was also serving as a chair of the regional UN interagency technical experts. And yeah, he was also based in Geneva for a while, in coordinating the implementation of the global strategy and plan of action on public health, innovation management. That means his topic is really innovation. We have introduced at the beginning, Mr. Gode was talking about what we'll be speaking today on the digital and innovation healthcare solutions generally. We will go through the possibilities, how to improve the universal health coverage in Africa. We know that, many countries are now focusing on that, but how would the private sector be involved in that case, in the whole situation with the digital and innovative healthcare solutions in place, and how affordable is that? What value addition is there, and how could the digital and innovative healthcare solutions be implemented in Africa? What is the experience and the challenges on board? it's supposed to be a discussion in that sense. So we'll start with a fast introduction of all the panelists, and then throughout, the panel will have opportunities to also discuss with each other. Not only that one person is talking the whole time. We want to have, even within the panel, someone who is already doing something in one sector could also add to what has been spoken about before. So let's start with you, Dr. Chibi. See how WHO is doing.
So thank you very much, Asma, for this excellent presentation. So I suppose you would want me to reflect on the questions that you have already posed, which I found very, very interesting. So you posed the interesting question: how can digital and innovative healthcare solutions be implemented in Africa? With my experience, I think I've been in this field for a while now, and also having gained experience across the whole value chain in terms of research, development, innovation management, healthcare management, and manufacturing as well. So what I can say is this field, digital health and innovation, is a cross-cutting area in its very nature. What does that mean? It means development, implementation, and scaling up of these solutions require a coordinated approach. And this is why at WHO we believe that if the Ministry of Health, for instance, is on the driving seat in articulating the demand for innovation, then it becomes easy to harness those solutions that will specifically address those needs. And on the other hand, it becomes even much easier to coordinate other stakeholders to support scaling up, including the private sector, and also pointing where private sector can really plug in their interventions as and when is necessary to drive implementation of innovative programs in a sustainable way. So what we have done at WHO, especially in view of supporting coordination of the innovation ecosystem in Africa, you may realize that we have developed what we call a regional strategy for scaling up health innovations. This was done as a way of capacitating countries to build their local innovation ecosystem that will see sustainable scaling up of digital and innovative healthcare solution that can be integrated within the broader health system space. If you want, I can also touch a little bit on some of the programs that governments are beginning to undertake. So I can speak on this subject from the perspective of the regional strategy that I've just alluded to. So ever since that regional strategy was adopted by all regional member states at our regional committee last year, technical requests started flowing from countries, to ask WHO to implement some of these innovation-centric programs. For instance, we are now helping Uganda to establish what is called Health Innovation Cluster. And what they've realized is Health Innovation Cluster is sort of a high-level coordination mechanism that will be housed within the Ministry of Health. This is very strategic in that they've realized that there are so many sources of innovations out there, but they don't know how to harness and capitalize on innovations that can really respond to their needs. So they've come up with this sort of a coordination structure and oversight structure that will be really driven from the Ministry of Health. And as WHO, this is exactly what we are supporting. Another project that we are implementing with regards to what you have just alluded to is what we are doing in Botswana. So Botswana requested for technical support to develop an integrated e-platform that will facilitate, harnessing innovations that responds to Botswana's health needs. But most importantly, those innovations can be monitored and evaluated for impact. And they are viewing this in the longer term to say, what are some of the policy changes? What are some of the infrastructure investments or even capacity development skills that they would obviously want, to plug in as this, field is evolving. So this is excellent to us. And maybe the last one, which is also at the core of my heart, is what we are doing with Ghana. We have realized that supporting innovation it's not just a technical orientation, but it has got the culture element. So we have realized that for innovation and digital solutions to be implemented, they require leadership, strong leadership, not only leadership from an advocacy point of view, but leadership with the understanding of the dynamics of innovation management. How can you foster, the culture of innovation? And also, how can you identify potential impact for innovation that can be scaled up? So we are introducing what we call innovation leadership program among the leaders in the ministry, like the senior colleagues in the Ministry of Health. And this resonates very much with the program that we are undertaking at WHO, which is called Leadership for Transformational Change. I don't know if I can also jump into what role medical technology play, but it's up to you, but I'll be happy to take it up.
All right, thank you for the introduction, Fasil. We'll definitely come back to you.
Great.
Yeah, let me move on to Douglas Graf von Saumer-Jelsch. He's an executive director, Malteser International, and it's okay, many of you maybe have already had what's Malteser International, maybe in details. It's a worldwide humanitarian relief agency of the Sovereign Order of Malta, and their mandate is to provide relief and recovery during and following conflicts and disasters. And they have already 60 years of continuous experience and over 100 projects in more than 20 countries. So in Germany already you do a lot of work and very supportive. A major player in Germany's disasters relief and healthcare. And how about in Africa? What is your role there, and what have been your focus on this innovative healthcare solutions and also the universal health coverage? You are on the ground. What do you come out? How do you feel the part of the projects? Maybe you can present what has been going on in Africa and how could we as a German also partners, private sector could come in as well. Douglas, it's green, but you're not talking. Okay, now it's completely gone. Okay. I think he'll have to join again. Okay, let me move now to the private sector. We have Agnes Mogiru of Siemens Healthineers as head of enterprise services in Middle East and Southern and Eastern Africa. Since January till today, but today before you used to be also enterprise global solution sales manager, and you are now based in Dubai. The last time I think you were in Erlangen. I wanted to know from your side, first of all, the role of Siemens Healthineers and the role of medical technology plays in regard to universal health coverage, and how could German companies contribute to reaching this coverage in Africa?
A very broad question, but in the interest of time, I will try as far as I can to narrow it down. But yes, so Siemens Healthineers is a global medical technology provider, so a leading one. We have over 120 years of experience in the industry. And the solutions are spanning everything from imaging, so to the lab, point of care, and also recently, as you know, cancer therapy. And so when it comes to universal healthcare, I think for us, I mean, when you think about everything, diagnosis, screening, diagnosis, treatment, follow-up, all of these are supported nowadays by medical technology. We even go as far as saying, you might argue that medical technology has become the central nervous system of modern healthcare. And so for us, I think that the point is to ensure that patients are able to have access to good quality care. Then it cannot be good quality care only for the, let's say, 1% of the population. Yeah, it's nowadays more of the technology is there. It's how do we get it to the people? How do we get it? How do we get this accessibility, affordability that we are always talking about? And key to that, and we take it for granted, especially in the West, is sometimes, not always, but is that somebody in the rural, so let me just take an example. I'm from Kenya, yeah, and somebody in the northern Kenya, somewhere in the close, pretty much you'd say arid sector, yeah. Imagine a Samburu or a Maasai. How can we ensure that they get access? And I'll take a good example to a good CT scanner. That when they need access to imaging, they don't have to trudge it through mud and take a bus and God knows what else to get to the capital, Nairobi, and only then can they finally get a scan. This, in this day and age, we should be finding better solutions to this. So for me, this is when I talk about universal health coverage. I'm really thinking in my mind about those people. Of course, also people in the capital cities, in the urban environments, but I think more importantly and direly needed is the people in the remote areas. So for me, universal healthcare is that picture. Yeah, it's making sure that that person has the access, and not just that, that they can afford it, that they're covered, that his family is not going hungry or begging, so that they can put together their coins so that he can get one CT scan. So this is something that we have to come together, and I believe the private sector, the public sector, the civil society, in making this possible. And as Rome was not built in a day, it's going to take the entire village also in this case. But I remain hopeful. I remain hopeful.
All right.
And I hope I've answered your question. I've tried as much as possible to,
Yeah, we'll come back to you. We'll come back to you. Don't worry. And yeah, okay. When we talk about the private public sector, we have a representative as well from the Ministry of Health Ministry of in Ethiopia. Dr. Bayen is a senior advisor to the Health Minister. And fortunately, she's also the president of Ethiopian Medical Women Association, which is also very valuable to our panel. And yeah, before she served as a CEO for the Center for Fertility and Reproductive Medicine. And she was also working at the St. Paul's Hospital Millennium Medical College in Addis Ababa. I mean, from the Ministry of Health in Ethiopia. Okay, Agnes was just describing how the private sector could come in, to have all these communities who are really disadvantaged be catered for in. That's what we call universal health coverage, isn't it? How is it affordable for such a ministry in Africa, for example, Ethiopia? How do you go about it, and what role does digital and innovative way of working in the ministry? Where does Ethiopia stand at this point?
Thank you so much, and nice to meet everybody here. Well, I really want to build up on what the last speaker just said regarding everybody plays its role to actually avail affordable and accessible healthcare and wherever the person is. So that's what we call a person-centered care. And digitalization, I believe, plays a significant role in accelerating our progress towards UHC. For Ethiopia, we basically based on primary health care. So our motto is kind of universal health coverage through primary health care coverage. So all our systems and our initiatives and our programs are built on that, on the primary health care. And we're trying to maximize on that. So regarding affordability of care and the role of digitalization in that, as you can see from the reports, nearly 70% of the world population also mobile. So basically we can just use that platform to reach to households and individuals to deliver care. And particularly when your system is based on the primary health care and based on prevention, you can deliver messages and you can actually mobilize communities using digital platforms. So we're trying to leverage the advantage of digital platforms to advance our agenda in the UHC and through PHC. So basically digitalization can improve the delivery of care in all of its senses. It can improve access, it can improve utilization, it can improve our emergency preparedness and response to emergencies, public health emergencies. At the same time, in the terms of universal health coverage, you need to provide affordable health care and people need to access it and utilize it. So we're trying to use digital platforms to avail supplies and logistics, including lab services, and to kind of generate a quality data which informs the decision making along the entire structure of the healthcare system. So right now we are working on digital platforms and solutions which are implemented along the institutions on community level and as well as patient or individual level. So we're in general terms, we're in the beginning of the digital era, but we're committed and the leadership is, my colleague here was talking about the leadership in actually the committing to implement digital platforms along and mainstreaming those digital platforms along what we do. And from Ethiopia's perspective, we have a big initiative called Digital Ethiopia, and we have a strategy for digital transformation of Ethiopia. Even though the finance and the agriculture sectors are also involved, but we're taking the major initiative from those, and we've just completed our the development of our digital health blueprint, and we're moving to digital strategies. Saying that, I want also to comment on how we should implement digital health as digital strategies or digital solutions and technologies in Africa. I think we need to have a harmonized and interoperable systems. We need to plan and implement multinational and multi-institutional platforms so that we capitalize and maximize on one's efforts and scaling up those efforts and learning from one another and creating a system where we collaborate is a way forward to go. Thank you. Back to you.
All right, thank you so much for his short input regarding, Ethiopia. Okay, let me move on to another private sector representative, Dr. Hamam. She's the Director of Governmental Affairs and International Cooperation at Ottobock. And maybe people would ask, what does Ottobock do? What does it have to do with innovations and digital? I think you have a lot to tell us, because even while I was checking on the website, they're saying world is changing. Digitalization is becoming more important than ever. How can we turn what is technically viable into real progress? Something that maintains or restores people's mobility. That's what motivates your research and development, and that is for over 100 years. The floor is yours.
Thank you very much, Asma. Yes, that's true. We're more than 100 years ago, Ottobock started in Germany as a little workshop and has in the meantime developed to a global medtech company with 8,000 employees and almost 60 subsidiaries worldwide. And we are active in the business fields, prosthetics, orthotics, and human mobility, comprising manual and electronic wheelchairs. And we have a new business field called industrial exoskeletons. And you're right, we help people maintain or regain their freedom of movement and prevent secondary health conditions with this. And we have, we in our own 240 patient care centers worldwide, we offer holistic treatments. And Ottobock is already active in Africa for decades. We have subsidiaries in Northeast and South Africa, and we have just last year opened our new subsidiary in Kenya. And yes, and it's true, we have a lot to do with digitalization. The orthopedic sector, as many sectors, health sectors, is undergoing currently massive changes through digital transformation. And new seamlessly connected and customized processes and new product solutions are evolving and responding to current challenges to increase access to quality care and rehabilitation globally. And these digital healthcare solutions in prosthetics and orthotics help to capture better data for demand planning, treatment, quality management, outcome monitoring, and related research. And for sure, they need to be integrated into health information, country-based health information management systems, and to inform decision makers, as it was just mentioned by the previous speaker. And they also can help to ease fabrication and treatment processes and make them more comfortable for users and service providers. And they can also reduce capital investments in workshop infrastructure through asset-light satellite centers, so that only very complex cases need to be referred to expert centers. And they help to further customize fabrication processes and increase constant accuracy. And last, they also can increase production capacity, so thus make efficient use of the scarce qualified personnel resources in the country. However, technological solutions are only one side of the coin. And in Africa, innovation is mainly required in terms of service delivery and supply chains. So smooth logistic processes need to be established in parallel. And especially custom and import across borders is currently quite a challenge for the private sector. And these challenges massively increase the cost of care and cause long lead times for delivery to the point of care. And so new service delivery models are needed to ease access to services in underserved areas, as also already mentioned. And digital technologies can support a wider outreach to patients and the quality also of treatment processes. And Ottobock invests on trial solutions that will play a massive role in the future, and that will enable us to scale up at the right price to increase access to affordable care and quality solutions. And Ottobock has developed a project proposal how a national prosthetic service, the national prosthetic service system, can be strengthened through multi-stakeholder partnership with governments, implementing and funding partners, and the private sector, and to support governments in achieving their goals towards universal health coverage. And Ottobock is very much looking forward to talking to interested governments in implementing and partners in implementing this project proposal at the national level.
Perfect. Thank you very much, Berit. Let me move on, as we remain with the private sector at the moment, also to a very traditional company in Germany. We call it Dräger. Dräger manufactures medical and safety technology products, and it's founded, of course, yeah, in Lübeck in 1889. You can imagine this is really an old family-run business, and even now we've seen during the pandemic, it was really also one of the companies that was also serving this safety technology products as well. We have here managing director for Middle East as a Koen Paradis. He's been holding this position since 2015, and yeah, he's actually, he started also very early in 1980, I'm just seeing, and followed by, and he started with the product management for anesthesia, and also marketing roles, took for some years, and also based in Dubai. The floor is yours. Yeah, you have to unmute. As usual, let's see.
Yes, my name is Koen Paradis. I'm the Managing Director for Middle East and Africa. And as you already said, I started with this company in 1980. So in the meantime, part of the furniture, I guess. I'm active in Africa since 17 years, I guess. And of that 7 years, almost 7 years now as a Managing Director for Middle East and Africa. So Dräger is very active in critical care areas like emergency departments, ICUs, operating theaters, neonatal departments, and we mainly commercialize life support equipment. So it's like you said, it's a very technical environment, a lot of innovation in there. We obviously also have a lot of digital solutions with remote service solutions and with interoperability and connectivity, all really nice buzzwords. But I strongly believe that digital and innovative solutions can be only implemented if we are directly on the market. That means we need, if we want to come on the African market with digital and innovative technology, we need to be at the market, and we need to support people there with a lot of training and with education. And therefore, just like the colleagues from Otterbock, we would like to open some more subsidiaries directly in Africa, because we need to share our know-how with the medical staff and the biomeds and the customers in Africa. I think this is of major importance if we want to implement innovation in a successful way. So the other thing is that companies, I think, should be willing to step into a long-term initiative if you go to Africa, because it's going to take time. Yeah, it's going to take time, and as one of the colleagues already said, Rome was not built in one day, and I think in Africa it will take time to develop this, but I'm really convinced that it's going to be worthwhile. Yeah. We are already involved in several initiatives together with the Deutsche Gesellschaft für internationale Zusammenarbeit, also GIZ, where in Kenya and Senegal we are setting up biomed schools in cooperation with the University of Aachen. We also have educational projects running with the Grote Schuur in South Africa. And with some other projects we're doing ourselves, also in Uganda, for instance. But I'm afraid we are not fast and pragmatic enough in the implementation of these projects. And the reason of that is, in my opinion, that we desperately want to, we must accept that Africa needs to go its own way. Yeah. And we need to support Africa with the experience that we have of the experience of European Institute, but we cannot impose the European way of working. Yeah, Africa and Europe are two different worlds. Yeah, and that needs to be respected. Then maybe Another statement I would like to make is that we should not overestimate the role of medical technology to reach universal health coverage in Africa. I think much more important for Africa, and this is shown now again during the pandemic, much more important for Africa is the availability of medical staff and basic infrastructure. I understand that people would like to work with the best and most sophisticated technology, and that is the same thing in Europe, yeah? But the reality is that in 80% of the cases, basic, solid, and qualitative technology can also do the job. And it doesn't mean that this basic technology is not innovative, yeah? If people know how to use technology and understand how to maintain that technology, that would be a big jump forward. And I think we have an important role to play there as an industry. Another thing I would like to address here also, it's one of my favorites. Africa is flooded with defective and useless medical technology because nobody is financing the running costs. So initial investments are done and donations are done and devices are sent, but repairs and maintenance of this equipment is not done. So basic technology with clear lifetime management strategy, I think is key if we want to implement digital and innovative technology. For the colleagues, I think, and I think they will share this, I think Africa is a very attractive market. And I think we still need to see the full potential of this market, and it's going to be achieved in the next decades, I'm sure. And I can only recommend that German companies invest in Africa. We need to increase our footprint in this market. Other countries and nations already started years ago to do that. And I think Germany and German companies still stands for quality and fair trade, so that's a huge value. And I think also in Africa. As challenges, I see, it's not very different from other places. You always have challenges when you want to implement solutions. Yeah, we have the usual bureaucratic obstacles, finding the right people. Sometimes the existing infrastructure is an issue for us. And then one of the biggest hurdles nowadays, and I think this needs to be addressed also, is the complexity of importing medical devices and the unreasonable processes sometimes for registration of medical equipment in Africa. The last 5 years, it's really become complicated. So that is in a nutshell what I wanted to tell and the input I wanted to give to open this discussion.
Yeah. Right. Thank you very much for already giving, some recommendations and already talking about, the challenges and all that. Yeah, we always ask ourselves, Germany has really like I don't want to say best companies in the medical sector, but it is known worldwide. But still, they're very hesitant to enter the African market, and we've tried to also pose so many information to try to motivate and all that. Where do you think, okay, maybe I'll put the question also to the other companies that are also here on board, where do you think would also be motivating from the other side, from the ministries or from the NGOs? I'm coming to you, Douglas, in a minute. How we can cooperate so that, we have, like what you said, time is there, and the need is there, the demand is there, but we still don't have those handful companies, like German companies that are on the ground. We are happy that Träger is there, Ottobock, Siemens Healthineers, but there are many more as who could cooperate and also do the same work and towards this universal healthcare. The programs are there in the ministries, but what is the problem actually? What is the problem? Like, let's say, do you want to add anything for Ottobock or Siemens Healthineers? Where do you see the challenges mainly? Or also,
from my perspective, as with everything, I mean, let's not also beat around the bush. I mean, we're talking about the private sector here. So for us, it's also a demand and supply perspective. And as the colleague from Drega has mentioned, I mean, I think the technology is there. That's not the question. It's more of where's the inference. And I think it's like chicken and egg right now. You have the infrastructure, you need the healthcare systems there that will demand and utilize this medical technology, because what good does it bring to invest in the latest and greatest or even basic technology if it will lie idle in 3 years or 4 years after the ribbon cutting ceremony? So I think for me, when I think about healthcare, and here I'm also talking as a African patient, so to speak, also, the basics need to be there. And when I talk about the basics, I'm really talking now going back to infrastructure. And I believe that we need to have, when we talk about healthcare in Africa and creating this demand and supply system, we normally talking healthcare players to healthcare players. I think what will really help to drive things is to talk now with, for example, the Ministry of ICT, Information and Communication Technology, because we need, if we're going to talk about internet connectivity and digital systems, we need to understand what the roadmap there is when it comes to digital for the countries. When we are talking about financing of these opportunities, we need to understand then how does the Ministry of Finance also play a role in this? How do they see healthcare, you know, on their agenda? And so I believe, now coming to the question of what is it going to take, it's going to take these different stakeholders, these different players who typically are not speaking to each other, to come together and say, okay, how do we want to build up healthcare in this in the countries? Yeah, how do we attract foreign direct investment from the healthcare companies and medical technology companies in particular in this case? So that is my perspective on what I think is required. And yeah, I think if I had to narrow it down to one word, we need to build up this ecosystem and turn it also then the output into laws and action. Thank you.
Yeah, thank you. And I can only stress what you said, what Agnes just has said. I think we have talked about a lot of challenges already: procurement, supply chains, the lack of professionals, or in terms of number and competencies, and yeah, service delivery infrastructures. And I think as a private sector, we can, and from the technological side, we can help to leverage the quality of care, the capacity and infrastructure building. But as I already said in my previous speech, the technology is only one side of the coin, and others have also lined it out. And Dr. Chibi already mentioned very correctly, the ownership of the government and the leadership is really critical for the success, and they need to lead the plan for scaling up, developing a quality service, and developing the policy framework and the enabling environment. And then the others can step in and fill in the different roles. When government leads the strategic plan and has the ownership, then implementers, partners can provide technical assistance to the government in terms of policy, regulatory and procurement, and provide the experience and expertise and assist with measuring impact. And donors can provide complementary funding for catalytic investments to help the financing, to cover the financing part. And the private sector can supply assets in support of scale up, and such as materials, equipment, provide market access pricing for its assets, and train professionals and deliver clinical services. And if this works, and if governments with the support of implementing partners and funders build up a resilient ecosystem, then yeah, this is, I think, also the perfect enabling environment where a private sector can step in and is willing to invest. And yeah, that's, I think, will be the way to the future. And
yeah, thank you for this valuable input.
Can I just probably just 1 minute come in there?
And then Roland Goede, you also raised your hand.
Right. So, thank you very much, Mr. Cohen, for that excellent input into the discussion. One thing that I always ask people, especially the private sector, I work a lot with these small startups and try to encourage them on how to sustainably scale their innovation. So of course, I've articulated what governments need to do and all that. But when it comes to the private sector, there is a little bit of a challenge there. Okay. So what are the opportunities that are there? So instead of maybe focusing on the challenges, I normally ask private sector to say, what are the opportunities that you are seeing? Mm-hmm. What are the low-hanging fruits? Mm-hmm. Because in most cases, what makes it difficult for companies to penetrate into the African market is the entrance point, the leverage, and probably the broader intention. I know, of course, private sector is profit-driven, but when you want to, the uniqueness of Africa is, if you want to build your house, try also to contribute to the building of the road to your house. It's natural that you would expect the city council to build the road, and you're just going to build a house. But what I normally encourage the private sector is contribute to the development of the ecosystem. Contribute in as much as I know there is going to be a lot of economic cost or transactional cost, but I tell you, once you try to get into that comprehensive approach in pushing your business in Africa, you realize that it's a long term. That's why we call it shared value kind of approach. So we have demographic dividend in Africa, for instance. There are so many intelligent innovators. How are you leveraging that? Right. Are there any opportunities for technology transfer, for instance? These are some of the things that, of course, you can start from an empowerment point of view. You can even partner with these local innovators or local companies in either developing those solutions or for them to engage them in some distribution or marketing of your product, because they know the terrain. And one of the things that I also found very, very interesting is most of these products that come to Africa, like I said before, in as much as they are very important, they are good, but in terms of them being adopted in that setting, it's very difficult. So you would require some kind of frugal innovation, for you to be able to even utilize that, because we were talking about a low literacy rate, connectivity being a problem, even electricity being a problem. So if you are going to deploy an innovation that has all those attributes, and you're going to deploy them into the hardest to reach places or in remote areas where there is no electricity, why can't you just innovate around having it solar powered? How can you just, why not innovating to say, instead of it relying on internet, you use USSD, for instance, because there is high penetration of these mobile operators. I'm just giving an example. So there is that element of adopting some of these solutions to the local context that obviously will lead to that kind of barrier or difficulties in penetration. But I just feel if we use what we call open innovation kind of approach, what is the need? Then from that, you can actually define target product profiles that from your end as German, you can now begin to develop those solutions that are tailored to the environment which they're going to be adopted.
Okay. Okay, let me go to Douglas. of Malteser International. I hope now you are set.
Can you hear me? Is it
Yes, we
working
can
now?
hear you.
Excellent.
Yeah. So what do you do? Do you contribute to the road construction or to the house construction?
I would say we do a little bit of both, but basically, really, we're focused on healthcare in general. And as it was said before, obviously, we need to prioritize and we need to see how to respond in what region, what area. And basically, in Africa, what we see is we need the basics, right? We need the consumables, we need the buildings, the facilities, the drugs towards a universal health care. It's really, first of all, it's that, to get the basics into place. And then comes what the gentleman from WHO has just said, and what we're needing for any further than innovative technology to be working is network coverage, mobile phones, all these sort of devices, again, infrastructure for it to work. But, and I think that comes, and obviously the private sector knows this, there is a huge opportunity if we look into areas like e-learning and telemedicine. I think it's not so much the equipment itself, which is great if we have it, but then how to use it. And I think there is still a huge potential for companies to look into that area as well, of how to be able to train people and to actually keep the equipment then functioning. And that again was also mentioned before. But let me give you a couple of examples where we have actually put into place these or done what I've just said. For instance, just now with the COVID-19, we've initiated a doctors to doctors program where German doctors with a lot of experience now in COVID-19 were able to talk to African doctors via telemedicine and video conferencing and so forth, and you know, simply exchange their experience and help each other. Now, on a larger scale, I think that's something that's very relevant when you look into the possibilities of a less experienced doctor in Africa who can then talk to a more experienced doctor in you know, a major clinic in one of the capitals. I think that's an important part. Another example where we've been able to use equipment from the company Weinmann, for instance, was mobile ventilators built into our mobile emergency units that in Kampala, in the wider Kampala region, where we've been able to transfer patients now with that highly technical equipment that wasn't available before. And just now we've had a case yesterday where we were able to transport somebody from Congo into Kampala to actually rescue him with this kind of equipment. So again, there's I think all that opportunity, but I also would like to add to your question, a question to the private sector. How has your experience been working together with NGOs? Because it's one thing to go into a country and to try to, you know, sell your products and establish that with governments, but also where do you see the role and what has your experience been in cooperation with the NGOs such as us? Because we can be a good implementing partner for you. That's basically our approach. Thank you.
All right, Dr. Bayen, or does anyone else want to respond to this point? Yeah, Sinead?
Thank you. I just want to reflect on the private sector engagement and implementing innovations in technology, particularly for medical equipments. For Ethiopia, we have the policy framework in place, the incentives in place, sector institutions are in place. We even have an industrial park dedicated for manufacturing. However, we still have difficulties in attracting direct foreign investment in manufacturing, particularly for newer technologies. Yes, we have issues with infrastructure, raw material supplies, the human resource, but the most driving factor for us in attracting and retaining foreign investors is the financial guarantee they look for. As we can understand, the private sector, they need to profit. However, the major driving factor for us is guaranteeing that financial requirement from the investors. I can give you examples. In Africa, we're trying to harmonize the regulatory mechanism all over Africa. We have a very stable logistics system, but still we're not having as much investors as we would like to have. For example, we're working with Siemens in establishing a local manufacturing for ultrasounds. it's now, it has been 2 years since we started the project, but it's not yet implemented because of the financial guarantee that we couldn't provide to them. So I think if we are able to alleviate that particular challenge, we would make progresses. Thank you. That's what I want to do.
All right, thanks. Yeah, does anyone else want to add anything at this point? Roland? Or
I'm not a panelist, and I hope I don't break rules, but just to
you're part of the private sector.
Forgive me, so my role was just of the welcome note, but no, just there have been so excellent remarks and some questions, and I would like, just as maybe a stimulus, short stimulus for the discussion, for the further discussion, I have noted some points. Of course, what has been mentioned on the potential of the cooperation between NGOs and private sector, I firmly believe this is a large potential. And from my own experience working for a diagnostic company, which originally has been a family-owned small medium enterprise, we have working since 20 years with the German medical aid organization Medior, for example, in Africa, with absolutely brilliant experience, a high level of trust, and it was really a kind of lighthouse experience for us in this multi-sectoral cooperation. And so same goes definitely for the potential with organizations like Malteser International or Johanniter. They have strong structures and they are close to patients, close to the programs, close to the people who need services. And that's an asset which sometimes the private sector does not have at that extent. So I just as short answer from my experience over the past 20 years, that's definitely the potential. And we see now from certain activities that NGOs, also Malteser included, are really working together with small but also large companies, which a few years ago maybe was not almost not could not be considered. So there's definitely a change, and there's even more potential. Then one question came on the let's say on the biomedical engineers on training in the chat, and I would just like to take that question that has been partially answered briefly. So there's, for example, in the German Health Alliance, a strategic alliance which had been born, which has been established of 5 companies and University of Applied Sciences for Kenya and Senegal, really focusing on that, training applied biomedical engineers, and that is going obviously to expand. So these are kind of cross-cutting activities which are crucial for strengthening health systems. So that's one of the let's say answers we're trying to provide. And I can confirm, especially our African friends and colleagues, that really most of our actors have understood the crucial importance of working closely together with African scientists, partners from academia. So especially when it comes to what I would call innovative, high-tech, low complexity, low cost, and specially adapted solutions in medical services and supplies. And that is something without the experience and the cooperation with African really brilliant experts, many innovation steps would not have been made successfully. And I'm telling this from the perspective of fighting against the 3 large diseases, HIV, AIDS, malaria, and TB. And even a small company, just to give a success story, I don't mention the name of the company, I don't want to make marketing, but even as a small company, which we have been, within a few years after the year 2000, we got active in 50 of the African countries. So there's a potential and it's possible. Last but not least, I have so many points, I don't want to steal your time, but I guess the problem we have is the bridging of innovation to implementation. And there are some international organizations and platforms which perfectly, in the meanwhile, address bridging this gap between innovation and implementation. And I would just like to highlight the UNAIDS Health Innovation Exchange, which has been launched at the World Health Assembly in May 2019, where NGOs, private sectors, and science has presented, after a pitch, solutions directly at the World Health Assembly. And 52 ministers of health have visited this exhibition booths showing the innovations in the health sector. And that, for me, has been one of the best experiences how to bridge this in the most direct way and to build confidence and to accelerate the implementation of new innovative solutions. So there are many, many ongoing pillars and activities. And my hope and wish, and that could be an answer also to the challenge, is that all these many strains, all these many activities and parallel channels are being better and more synergetically and systemically bundled with the with the support and with our proactive lead and commitment from all the sectors. So thank you so much for allowing me to take some of your time.
That's yeah, we can see how experienced you are, good from all sides, NGOs, academia, and companies. Yes, I think Barry, you also wanted to say something regarding you. You work also together with an NGO, isn't it?
Yes, we have also several experiences with working with NGOs, and yeah, I think it's a great opportunity as long as we are sharing the same goals and objectives and increasing access to quality care. And and there are a lot of NGOs, which is, I think it's a broad spectrum, I must say, and with very experienced and competent implementing partners among these. But there's also another side of the coin. We are looking a little bit more cautious on the ground. These are more philanthropic oriented little NGOs, which are donating low cost devices, and that often we see are not really adapted to the needs of the patients, and and this leads sometimes to our oversupply of patients with bad devices and leading to secondary health conditions. And where I think it would be if you would orient your investment rather on health outcomes, you could really make a better impact in considering your investment and what you want to achieve in terms of health outcomes. And as long as these NGOs and civil society is also interested in strengthening health systems in a sustainable way and not just make them donor dependent and dependent on donations, then I think we see great opportunities to work together. And this was one comment from the several I had on the speeches of my previous speakers. And certainly training is very important, training of professionals. And e-learning is a good opportunity to reach out to a wider audience and to reach more health professionals. And Otto has already set up with its Otto Academy, which is long established, and we have several e-learning training programs and use it on a regular basis for our own trainers and professionals worldwide, but also to customers and others, and working also there with NGOs and university programs to improve education. However, I again come back to the systems level, because we often also made the experience, if you train professionals and they are not able to apply it in their environment, or if these professionals are educated at universities but the environment is missing to retain these professionals and to employ them, then all efforts are worthless. They leave the branch, they go to other areas such as Asia, especially in our branch, which is really low prioritized in national health plans, and sometimes even not included. And so this is why we are really focusing on a systemic level. And also a remark to Dr. Modrek Chibi on the opportunity to work with startups. Yes, we are working with startups, but again, technology is only one point, and it's not the technology. From our perspective, the technology is there. It's everything there from the technology you can support. And we have also developed concepts to support governments with the existing technology and the emerging technology to build up the roads. But there needs to be the need and the demand and the leadership and the ownership of the governments to say, yes, this is a priority for us, and we need this plan, and then we can support. We are also willing to build the house and also willing to build the roads, and we have even concepts for that.
Fantastic. Yeah. Yeah. Do you want to add anything, Dr. Chibi or anyone? Agnes? Agnes, do you offer also some solutions, right?
Yes, I think I was just trying not to repeat what was mentioned, but yes, I think the. Sorry?
It's okay. Yeah. Yeah, can you hear? Okay.
Yes, I think I would just support what has been said before. I think the solutions are there, and we can, I mean, I can name them from top to bottom, from clinical information systems to consumer apps and so forth. But I think, as mentioned earlier, it is, and this is my hope and vision, that we will sit together and develop this roadmap, that it will be a phased roadmap. And that it will be a multi-stakeholder session. I think this is where we will need to come together, the NGOs. And I know it sounds very complex, but I think we need to think about how can we really bring these different parties to the table and say, okay, how do this roadmap work? I really loved what was mentioned from Ethiopia in the sense of developing a blueprint. You know, it takes a lot of work, but that's what is going to be required before we can build this house and before we can build these roads. Because where does the road lead to? Exactly, you know, what houses do we want to build? And where do we get the cement and so forth? So roadmap needs to be designed, and I think then the rest will fall into place.
Okay, yeah, I mean, yeah, we've had really valuable input in this panel so far. From the private sector, we see you know, what they can offer, how far they can go, what is needed on the ground, and how could there be more cooperation with NGOs. We you know, we are also in Germany. Maybe we also have to understand the health sector has always been yeah, in the framework of development cooperation, isn't it? Till now, you know, it was really like support from the government and helping hand and all that. All these projects which are now coming up, and also some concepts with the private sector together with GIZ and also NGOs together. I think it's coming up now, and it will be strengthened in the near future. I think that is what I think will be more sustainable, because we have seen also many projects which have been implemented by the development sector. After 3 years, they're nothing. You know, it's like yeah, there's no sustainability in the projects. And if a private sector comes in, there is a kind of a sustainability hand which has interest to have, you know, the project going on and going on and being sustainable for everyone, isn't it? So I think if all these stakeholders could come together, really like what we are all agreeing to, they should all come together hand in hand and seeing who can do what in this chain of value adding. You know, the most important person is here the patient, isn't it? I mean, he's the last person to receive all these services, and how affordable is it for him or her, and how could all these stakeholders in the market come in? Douglas, you have something to add? I think you You just raised your hand.
I just love being very practical. I would like to invite the representatives of the private companies who are here to come and visit us in Cologne, or we come and visit you, and to look and to understand more what it is you are doing, to present what it is what we are doing, where we are present, because I think we can really be a very good link, like it was said before, not only because we are on the ground and we know what the needs are, but also because we are, like it was mentioned before by the representative from Otto Bock, that we are used, the bigger organizations are used to working with institutional money from government. So we have a very high level of professionalism, of implementing programs, of being responsible with finances, and just being, I don't want to brag, but just being very professional in this sense. And I think that we can meet on that level and see what we can do, because I'm sure that you know, my people don't know all the products that you have and approaches that you have, and you probably don't know or have not seen in depth yet what an organization like ours can do. So final invitation, please come and visit, and let's get to business.
Perfect. I mean, if
noted and accepted.
if that's the outcome for today, I think we have won everything, isn't it? That is what we want. We have holistic approaches. Agnes, you come over to Cologne, isn't it? And
COVID as precautions permitting, yes, why not? I'd like to add something that we didn't touch on, or at least maybe I missed it, and that is the African diaspora in healthcare.
Okay.
Well, not just in healthcare, in other industries. What we're seeing is, and I look at myself also, we have a lot of Africans who are in Europe, in the West, in Asia, who have experienced both healthcare systems, yeah, and they've seen the good, the bad, the ugly of both sides, yeah. I don't think there is any utopia healthcare system that any country can brag of. And I really believe in the power of also the diaspora in helping to bring these two sides together. As a colleague from Draga mentioned, you know, let's not also try and force feed into Africa, you know, Western or Eastern solutions. Let's figure out what is the best solution for Africa. And I think these diaspora stakeholders could really play a role in helping to avoid things getting lost in translation.
Okay, lost in translation. Okay, we're building bridges, we're building houses and streets, they are lost in translation. So do you have last statements for today? Because we don't want to overdo it. We have a football match afterwards with Germany. So we don't want to miss it. Koen, do you want to add anything?
Well, I'm happy that our colleagues from Siemens Engineering, they agree, or Siemens Healthineers. Yeah, I mean, as I said, you know, there are a lot of things to do, and we have to work on, we have to build the street and have to build the house. But I have to underline, it's going to be worthwhile, you know. It's going to take time and it's going to be worthwhile. And yes, we need to make sure that we share our know-how, and I also will shortly will take contact with the colleagues in from Malteser and visit them. But I'm okay. even after all that time, I'm still very positive.
Yeah.
So.
All right. Yes. Yeah, we are happy to arrange all these meetings for you with GHA. I mean, perfect. We have a perfect match: NGOs, private sector, and of course, we'll not forget the ministries to be part of it. Okay. Last round. Does anyone want to add anything? Are you happy, Dr. Chibi, with all these statements?
Yes, I'm reasonably happy. Just to reiterate that the opportunities now, COVID-19 has taught us what the private sector can contribute into the whole response. And this is what we definitely need to take advantage of. And from our end, we are increasingly seeing, you know, governments reaching out to private sector. You know, this is of course one of the priority areas for WHO to see how this PPP, you know, strengthening of private public partnership to deliver healthcare. And as you know that the healthcare delivery model is going to change thanks to COVID, and private sector is indispensable in this in this case. So all I can say, we are here to support you as WHO, and count on my support. And I know both worlds, and I know the value of both worlds. Over to you, thanks.
You're also welcome to the circle we're going to hold. Okay. Yeah, anyone else who wants to add anything? I think it has been a really fantastic panel. We see how important it is, also to see Africa needs its own way, and how the private sector can build up on it, and training for the staff on the ground is also very important. So let me give it to Roland. You want for the closing? Thank you very much to all of you. It was really fantastic to interact with you. Thank you very much.
Yeah, thank you so much, Ms. Nitadi, and thank you to all of you, really wonderful and expertise panelists, and that has been a pleasure to have this panel today, and it has been a special, really specially positive climate of discussion for which we are really grateful. And I guess what can we put as summary? So it seems that there are many things going on, many activities and projects existent and also in the pipeline. And obviously we all still need to build better crosslinks between all these activities, projects and platforms, opportunities. And we need to integrate over all these elements in order to achieve the best in health system strengthening and universal health coverage. And when it comes to that goal, it still seems that mapping and matchmaking is a crucial element, and we cannot do enough work on that point of mapping and matchmaking. And I also wish that from side of Africa Verein and GHA, we will be able to foster more of this crosslinks with our joint working groups on health we have with Africa Verein and GHA, also on working groups we have in the GHA on development, cooperation, and global health. We have already elaborated with the German government structural solutions for the quality in procurement. So a concept, a strategy called systemic calls for tenor in the health sector. So all this is available, but obviously we need to exchange our knowledge even much more in future. And I would just like to close pointing to two events, upcoming events, which kindly enough the ambassador has mentioned briefly in his welcome remark. So end of October is an important timing because there will be the next World Health Summit in Berlin. And one day after the official closing of the World Health Summit, there will be the 8th German African Healthcare Forum on the 27th of October, where usually more than 200 participants from Africa, from Germany, from all sectors are coming together. So we hope to see you there. Hopefully it will be possible in autumn. And there will be a joint panel of Unite, UNH, GHA, and that is a touching point to this panel. There will be a panel at the World Health Summit on the 25th October, the role of policymakers in digital health innovations, because we touched the point of the importance of the policymakers giving the right frame and leading the right way. And it would be wonderful to see you again. For now, I would like to close the session with a big round of applause to our panelists and to the ambassador and to all our participants having stayed here online. Thank you so much for your questions and remarks, and wishing you all the best. Stay safe and healthy. And wherever we will see you again, it will be a pleasure. Might it be Cologne or Kampala or any other place in Africa, as Africa has deserved a physical World Health Summit regional meeting again very soon. So we hope to see you in Africa. Thank you so much.